So this is very new for everybody, having a hybrid event. So we are streaming on both locations here in Microsoft and also in Rochester IT. So I think we'll get started. Val, we can't hear you.
Hopefully you can hear me now. Great. Welcome, everyone. It's great to see all of you here. So my name is Matt Unerfauth. I'm Dean of the Golisano College of Computing and Information Sciences here at RIT. And I want to welcome all of you on behalf of RIT, HIMSS, as well as our School of Information here at RIT, where our Health Informatics Master's program is based. So a big reason why I wanted to get a chance to welcome you is that we really view health informatics and the healthcare industry as part of our future here at RIT, and as really part of the future of the computing field as well. And strategically, this is a really area of high importance for our college. So I'm really excited to welcome you to this HIMSS annual New York State event here. It's broadcast from Rochester Institute of Technology and simulcast with an event happening in New York City right now. So we were very happy to host this event last year as well. And with this year, the new focus on nursing and informatics across the patient healthcare continuum. So here at RIT, we actually have a lot of interactions with the healthcare domain. Some of this is in the area of research, some in educational programs and industry partnerships. And it was great to get a chance to meet some folks outside at the reception before this began today. We're really delighted to welcome HIMSS to serve the New York State healthcare community. So now with that, I'm very happy to turn this over to our New York State chapter HIMSS board member, Valerie Sawicki. I'll invite her to the podium for her to kick off the symposium. So thank you all for joining us today.
Thank you, Matt, and thank you all for coming. I am Valerie Sawicki. I am a member of the New York State HIMSS chapter board, as well as the chair of this symposium planning event and co-chair of the nursing committee with my other co-chairs who are in New York City right now, Romina Elias and Elaine Arneson. We also have our chapter board or our chapter president, Helen Figge. She wanted me to apologize to let you guys know that she wanted to be here. She was intending to be here at the Rochester location, but she got called away for work. But she does wish everybody the best, and she's going to be watching virtually. To kick us off, we just wanted to let you know a little bit about what this symposium focus is. And we're focusing on the critical role that informatics plays in healthcare, and particularly in nursing and informatics, which is a booming industry, but not many know about it. So we are trying to showcase how informatics through nursing can support our patients, their outcomes, and help healthcare delivery across the care continuum. And with all the transitional care gaps, that's going to be kind of our focus on how informatics and nursing can help support our nurses and the patients. I invite you to really fully engage in the speakers. We have some great speakers here across the state and from diverse parts of the healthcare industry. And with that, I'm going to kick it off to my New York team, and they're going to give us the disclosures and the agenda for the evening's panel. So with that, Romina and Elaine, take it away.
Thank you. Thank you so much, Val. So I think the biggest hurdle for tonight has hopefully been accomplished, is that we're actually able to hear and see each other from both sides, right? So that's a big thing. So we're very happy to welcome you all. I am Romina Elias. I am the co-chair for the nursing committee for New York HIMSS, and co-chair for the planning committee for the nursing symposium as well. So I'm going to pass it on to Elaine, who is our secretary for the New York HIMSS nursing committee and a co-chair for the nursing symposium. She'll go over the agenda and the run of the program.
Welcome, everyone, and thank you so much for attending today, even though it's raining outside and the weather isn't so great. So thank you for coming. Just going to go over our ANCC disclosure statement. This nursing continuing professional development activity was approved by the American Association of Critical Care Nurses, an accredited approver by the American Nurses Credentialing Center Commission on Accreditation. Thank you, Kim Velez, for making that happen. I'm just going to go over some learning objectives for today. Today, we are going to explore and understand how informatics innovation bridges critical care gaps across the continuum and identify the potential of integrating technology with compassionate care to improve patient outcomes. We're also going to develop some strategies to transform interdisciplinary approaches and leverage technology in healthcare. So very excited for you all to experience this panel. We're going to have a lot of stimulating conversation. Just going to go over a quick run through of our agenda today. We are going to have Dr. Michael Hasselberg at RIT give the keynote speaker. And then Kathy McKenna, who's part of our HIMSS planning committee, she is going to be introducing Dr. Hasselberg. And then after that, Dr. Hasselberg is going to join us for an interdisciplinary panel. It's one panel, two sites. That's our dream, that's our hope, and hopefully that will happen. And one panel is going to be in New York City, one panel is going to be in Rochester, and we will have a back and forth interplay between both of these panels. If everyone could just mute their phones just to make sure that we can hear all of this amazing conversation going on, I would really appreciate it. For our virtual attendees, if you could just keep your questions until after the panel, we're going to have a Q&A. And for our in-person attendees for Microsoft, if you could just hold your questions until the end, and then if you could come up here to ask your questions, this is the best way that Rochester is going to see you. So we can have a little dialogue here with everyone. And then after the panel, we are going to have some dessert and some networking. So please enjoy. And I will kick it off
through to a live forum. I just wanted to actually, before we kick it off to our speakers, if we can just recognize the planning committee and thank them, please. So if you are on the here in the room in New York City and in RIT, if you don't mind just standing, we just wanted to thank everybody. There has been a lot of work to put this whole planning committee together. So thank you. Thank you so much. And I think it's, I would say that it's been a success already since we're live streaming from both locations. So I'll kick it off to Kathy.
Thank you. Thank you very much. From University of Rochester Medical Center. He is the Associate Professor of Psychiatry, Clinical Nursing, and Data Science at the University of Rochester. And he is the first Chief Digital Health Officer at UR Medicine and the co-director of the UR Health Lab, the health system's digital health incubator. He gets to work with really fun startups and do fun stuff. He was named in the top 50 in digital health by Rock Health to recognize his contributions to improve health equity during the pandemic. He's board certified as a psychiatric mental health nurse practitioner, and he also completed his Ph.D. in health practice research at University of Rochester and postdoctorate certificate in health leadership at the Johnson School of Management at Cornell University. His expertise spans health and technology as a Robert Wood Johnson Foundation Clinical Scholar Fellow and committee member for the National Academy's Standing Committee on Primary Care. He's been an advisor on many digital health modalities to the New York State Health Department and Department of Health and Human Services, as well as the National Quality Forum. He also serves as an independent consultant to several digital health fund startups, and we are very, very privileged to have him speak today as our keynote speaker.
First off, thank you for having me. I'm super excited. I'm gonna have this colleague next to me pull up the slide deck. All right, I think we're ready to go. So what I want to talk about today is how technology has transformed healthcare, how technology is going to continue to transform healthcare, and really, how nursing plays an integral role to all that. There's no question. See if I can get the slides to advance. There we go. There's no question that over the last 4 years, healthcare has been fundamentally changed in this country. We all remember this date in March of 2020 when the first patient arrived with COVID in our community here, and our health system, the University of Rochester, and every health system in the country had to transform overnight. One of the things that we learned during this pandemic was nurses are the heartbeat of healthcare. There would not be healthcare if there were not nurses. It was our nurses that led the transformation. I mean, almost overnight in our hospitals, we had to bring in telehealth technologies. We had to bring in iPads and tablets so our patients could be connected with their family members outside of the hospital. And it was our nurses sitting next to those patients during some of the most isolating, scary times that we've ever seen. It was during this time that we really saw virtual nursing take off, where not only were we connecting patients to family members, but our nurses were doing consults to other hospitals in the community, doing admissions and discharges, all via telehealth. The concept of sitting next to patients that were on fall precautions suddenly went from having one nurse sitting next to one patient to having one nurse watching videos of 15 patients. This all really took off and transformed during the pandemic. But what we also know is healthcare has continued to be disrupted and has moved beyond the hospital walls and into our clinics. We've seen over the last 3 to 4 years, the concept of this digital front door, this concept of how can I, as a patient, conveniently access my healthcare providers. So we saw things like patient portals, online scheduling, on-demand telemedicine, the ability to pay your bill at the touch of a button on your phone. That all really started to come to light over the last 3 to 4 years. But it continues to shift, and it continues to shift now beyond our clinics and into patient homes. And now we're thinking about how can we do things like hospital at home, which is not a new concept, but now we're talking about it. And it's our nurses that are driving those discussions about what does healthcare in the home look like. It's a really exciting time. And again, it was a pandemic that kind of drove us to this place. But when I think about the future and where we're going, pretty soon it's going to be technology that's going to be driving us to where the next step is in healthcare. And it's going to be artificial intelligence. And let me begin with a story. And this story actually starts in New York State. And it starts in a company about 2 hours away from here, down in Binghamton, New York, a company called IBM. In 1914, IBM hired Thomas Watson Sr. to take on the role of CEO and president. And Thomas Watson asked this question, can machines think? And he really pushed his workforce to think about the possibilities of partnering with machines to think better, to be more efficient. Everyone from the assembly line worker up to the engineer, from the secretary up to the chief operating officer. This was something that he pushed out in IBM. And it ended up being IBM's motto, think. And this concept of inquisitiveness, partnering with machines became the culture of IBM. Over the next 100 years, IBM has been a leader of developing supercomputers. And, these supercomputers have started to become intelligent, to start thinking. From in the 50s, these machines winning in checkers, and then moving on from checkers to chess. It was IBM supercomputers that helped put the first man on the moon. It was actually, however, in 2011 that the world was awed by AI, where at that time, IBM created a new AI model called Watson. And it really wasn't one model. It was essentially multiple small natural language processing models put together. And the way these models worked is it could predict what's the next word that's going to come out in a sentence. It was really good at answering questions. And so where were they going to test this model? They tested it on Jeopardy, and it was televised across the world. Could a computer beat some of the top Jeopardy champions that's ever played Jeopardy? Watson won, and Watson won by a large amount. Awed the world. It was the first time that I think society saw the potential of artificial intelligence. A year after Watson won in Jeopardy, IBM took on a really audacious task. They said, we're going to bring this technology into healthcare. We're going to disrupt healthcare. And IBM partnered with some of the leading health systems in the country. Down in New York City, Sloan Kettering, Cleveland Clinic, MD Anderson, and they set out in oncology. They wanted to use this technology to help our clinicians make clinical decisions, come up with cancer diagnosis faster, identify what is the best treatment for this patient, even potentially develop a new drug to cure cancer. IBM spent $5 billion buying healthcare data. Unfortunately, less than 10 years later, IBM dissolved, sold off Watson Health for parts to a private equity fund for pennies on the dollar. And you question, you go, how can a company with such a long history and culture of computer science, data science, some of the most brilliant data scientists in the world, who have partnered with, again, some of the leading health systems, leading clinicians, researchers, scientists in healthcare, and they bought $5 billion of data. How could they fail? Well, first off, healthcare data is really dirty. It's a lot of garbage in it and really noisy. Watson was trained on 200 million pages of encyclopedias, dictionaries, very structured data. And when they attempted to leverage this technology in healthcare data, they did not get the results that they had hoped. Over the pandemic, another thing has happened. Our workforce is burning out, and we're seeing that with our nurses. We did a lot of amazing things with technology for our patients, created new access points. Never before has our patients had as much direct, seamless access, emails, patient portal messages, text messages to our clinicians than they've ever had before. But our clinicians are burned out. And one of the problems that we saw during the pandemic that was getting really significantly difficult on our clinicians was patient messages coming in to our clinics. And, what we essentially try to do as a health system, and we still do this today, is we have nurses that is their job, is to sort these patient messages out, to say, this message coming in goes to a staff member, this message I can handle as a nurse, this message goes to one of our providers. Totally below the scope of practice of a nurse, but that is the way we are trying to solve this problem. So my health system came to my team, the innovation team, and said, this seems like a perfect machine learning problem. Can you build a natural language process algorithm that essentially sees these messages coming in and says, this should go to a staff member, this should go to a nurse, this should go to a provider? And we said, yeah, we're going to give this a shot. When we started this process, and this was an early pandemic, this was 2020, 2021, we took a pretty classical machine learning approach to this problem. We did very similar that what IBM had tried to do with Watson. We first tried to take a supervised learning approach. And what that means is essentially we use nurses and we use providers to label patient data, to say this message, that's the bucket it goes into. But what we quickly found out was we didn't have enough nurses and enough providers to label enough data to build a training set to answer that problem. So then we said, you know, let's take another approach, an unsupervised approach. Let's just let the machine look at the data retrospectively. Let's let the machine use probabilities to say these messages should be categorized in this bucket versus this bucket versus this bucket. And what we found out was it didn't work. We spent an entire year on this problem. I had 2 full-time data scientists partnered hip to hip with nurses and providers to try to solve this. And again, what we found out was very similar to what IBM found out. This data was very messy. There was a lot of variability. And what the machine thought were the appropriate categories for these messages really had no clinical significance. Fast forward to 2023, and now the world is awed by generative AI. The world is awed by ChatGPT. And this is everything that people are talking about these days. Let me tell you, generative AI is fundamentally different than the classical machine learning that IBM tried to do, and the classical machine learning that my team tried to do. Let me tell you about how generative AI works. Let's start with the entire internet. Imagine that. First step, we're going to download it. All of the data in the internet. Text data, image data, speech data, structured data, signals data, 1 trillion plus parameters of data. That's where these models are starting with. These models are then trained using a new type of architecture, not really focused on probabilities of what word or what data point's going to come next. It's using a transformer architecture that's really starting to understand the meaning behind the data, the context of this data. And then this data comes to us, the consumers, already pre-trained. We've had big companies like our colleagues at Microsoft down in New York City there, colleagues like OpenAI, Google, Amazon, others who have spent lots of money to build these large foundation models. Here's the really cool thing. These big foundation models come to us, and then we can adapt them to do a lot of different tasks. And the way we adapt them is things like just telling it what we want to do and being very, very specific. You don't have to be a computer programmer or data scientist to use these models. And what's really transformative about generative AI is the generative part. It actually generates new content. Sometimes the content is right. Sometimes the content looks right and it's pretty convincing that it's right, but it's wrong or not fully complete. But what we're finding out is more times than not, it's pretty right. It's pretty accurate. So what we have seen in the industry is a lot of big, bold bets on how generative AI is going to transform healthcare, how it's going to transform nursing. We've seen big companies like NVIDIA, one of the biggest chip makers for GPUs in the world, partner with startups who make audacious claims of we're going to build generative AI nurse bots that is essentially going to do what our nurses do. So I asked generative AI as a nurse, what is an AI nurse bot? This picture you see, that was created by generative AI. That is what generative AI thinks an AI nurse bot looks like. Let me tell you, I am not convinced that these companies are going to be successful because there are things that nurses do, that clinicians do, that a machine can't replace. Therapeutic touch, empathy, developing relationships with patients. I'm not convinced that a machine's going to be able to replace that. But what I will tell you is generative AI and this technology is going to prevent nurses from leaving the profession altogether. It is going to transform our profession, and it's going to bring the joy back to nursing that a lot of our nurses are missing right now and are getting burnt out about. And let me kind of tell you our experience thus far with this technology and what we've been able to see it do and do well. So let's first start with, you can in this room go to the ChatGPT free version on OpenAI, but you can't put PHI data into it. You can't. It's not safe because that data will be used for further training and it could be pulled out. There's a paid version on the web that you can pay for to get ChatGPT 4, but that is also not secure. You can't be putting PHI data into that. There is, however, secured versions of this. And we were very lucky on our innovation team in our health system to get early access from our partners at Microsoft to have ChatGPT 4, some of the other foundation models in a secured private instance on our cloud server in a manner where we could put PHI into it and be assured that our data was safe. And we've been building tools using GPT, other foundation models like Google's Gemini and Bard, Facebook's or Meta's Llama, and we're blown away, absolutely blown away of the potential. So let's go back to that original problem that our team spent a whole year on that we couldn't solve, of triaging patient messages. So what we did was we said, let's see how GPT-4 does solving this problem. So the really interesting thing about generative AI is it's very sensitive to the prompts. So what you tell it to do and how specific you are, and if you can provide it examples, it does really, really well. It's like an ambitious kind of student wanting to get better, wanting to please you. So this is the prompt that we built to triage messages. Essentially explained to it what the different roles are, examples of different messages that each of those roles would potentially manage. Essentially put the prompt into GPT-4, got a patient message that comes in. Essentially this message, patient needing a biometric form filled out, wants it sent back, wants the last weight and height used. And today, this message would either go right to the nurse in the nurse pool, or if you're in a clinic in our health system that doesn't have a nurse pool, all of these messages go to the provider. So put this message in, and essentially the generated response that came back was this message could be handled by a staff member. And it described what the message really needed. We did this on our data. We had found that GPT-4 is 97% reliable on putting these messages consistently in the same bucket, 87% accurate. We've been running this outside of production, comparing it to our human nurse who triages these messages. GPT-4 outperforms the human nurse of triaging these messages. How much does it cost for GPT-4 to triage these messages? It's an estimated $14.75 for every 1,600 messages it triages. Our nurse maybe gets through 50 messages a day, and we pay our nurse a lot more money to do that. But this is not all that GPT can do. You still have the generative part of this. And so we wanted to see, well, what would GPT respond back to the patient if we asked GPT to respond for this message on behalf of the provider? And this is essentially what we got. And it's pretty good and it's pretty accurate. And one of the things that we have found with this technology is it is actually pretty empathetic. And it's actually, in a lot of cases, more empathetic than our human, because our humans are pretty burnt out and don't have much time. And it will provide, I hope this message finds you well. And, you know, our patients like this. There's a lot of potential, but it doesn't stop there. You know, one of the things that is really time consuming for our nurses, for our clinicians, is searching through the electronic health record, trying to find the data that you need for that patient at any given time. This is something that is perfect for this technology. In our innovation team, we already built a chart summarization tool, ability to essentially use it like Google and search what you need in the chart, and it will pull it up. Example of this tool is, as a nurse or as a provider, you could say, these are the things that I need when I see a patient, and I want it pulled up right away and packaged up nicely for me. It does it really, really well. We've taken this to another level. Registries. Every health system has to submit data to registries for quality metrics. How is that done today? I'll give you an example. Vascular surgery in my health system, we have 8 full-time nurses. 8 full-time nurses. Their job is to manually go into the record, find discrete data points, package it up, submit it to a registry. We've already built a proof of concept to show that this technology can go into the record, find those discrete data points, package it all up. I still have a human, the nurse. Instead of needing 8 nurses, now I only need half a nurse to validate that that is the correct data and send it up. Much cheaper than having 8 nurses. So then the concept of documentation in general. You know, we spend more time now as healthcare clinicians behind a computer screen, and that is not what we went to school for. We went to school to lay hands on patients, to be there next to the patient. But because of regulatory things, we're in front of that computer all the time. This technology can do the documentation for us. And this is not Star Trek. This concept of taking a listening device. Just imagine Google Home, Alexa, Siri, or even a listening device on your phone. Put it between you and the patient, have a discussion with the patient. The generative AI will take the data that's appropriate for the note, package it up, put it into the note for you. The stuff that's irrelevant, it will get rid of. This is deployed in our health system. I suspect it's deployed in our partner health system, Rochester Regional, across the street. And I'll give you a demo, very brief demo of what this looks like. And again, it will capture the data that's relevant and put it right up into a structured note. And you still, as the clinician, have to look at that note, validate that it's accurate, but it saves so much time. When we introduced this technology to one of our busy orthopedic surgeons, she burst out in tears when we introduced it and said, this will allow her to finish her day on time so she could actually get home and spend it with her own kids and her own family. this is going to transform healthcare. This is going to transform nursing, and it's going to allow nurses to, again, get back to the joy of doing clinical decision-making and finish your day on time to go spend it with your own loved ones. But let's get back really briefly to virtual nursing. And this is something that has been talked about around the country, and a lot of folks are doing it. But AI can take virtual nursing to a whole nother level. When you think about our hospital and you think about the technology that's already in our hospital, we have cameras, we have sensors all throughout our hospital collecting data, and we can leverage that and apply AI to, again, transform healthcare. So we have seen computer vision, which is another type of machine learning strategy of taking vision data, packaging it up, and making sense of it. We've seen a lot of startups partner with virtual nursing companies and train models to identify when a patient's at risk for falling and flag the nurse, or identify stupid things that as nurses we have to document, like when did everyone wash their hands in the room? When did the patient roll into the OR? When did people put on gloves? When did the first cut? We have nurses that are not at the bedside, but are just documenting these things. But let me tell you, it's going to become a lot easier to build these vision models, leveraging these large foundation. So what I'm going to show you here is a time lapse of a surgery. It's very, very quick. And I downloaded it from Getty Image. And a lot of us recognize this in the room, and a lot is happening in this video. And what I did with this video was I took it and I put it into one of these foundation models. I just uploaded it. I did no training of the model. I did no further prompt engineering to label anything in that room. And I started asking it questions. So one of the things I asked was, when did the doctor put on gloves? Because we document that as nurses. Immediately went to the frame of when the doctor put on gloves. When did the nurse count the instruments in the room? Press search, immediately went to right in that the video of when the nurses was counting the instruments. Did the doctor look at the x-ray? Hit the search, immediately goes to the doctor looking at the x-ray. I did not tell the foundation model what a glove was. I did not tell the foundation model what a nurse was, or what a doctor was, or what an x-ray was, or what instruments was. This is right out of the box. So just imagine with using prompt engineering, again, what the future of healthcare is going to look like. So getting back to that concept of, will AI replace nurses? Again, they won't. It won't. But I am fully confident and I am bullish that this technology is real and it's impressive and it's different than AI of the past. And I am fully confident that it's going to totally make our profession look different in a good way. And so I'm really, really excited about the future. And I hope everyone in this room is excited about the future. And I would encourage you, don't be fearful of this technology. Embrace it. It's coming. Thank you.